Most dentists and assistants end up with low back and neck problems. If the dentist is right-handed, they'll often end up with a problem with the right part of their neck at the base of the skull, and then a back problem because they're bending forward like this. So the objective is to get in a position where you're sitting up straight, supporting your back with your stomach muscles. That's why it's a good idea to do some crunches or sit-ups periodically, because they say a strong stomach is one of the keys to having a healthy back. Let's talk about sitting position of the dentist and assistant working at the dental operatory. First thing I always like to do is get the patient up in the chair. You want to get the chair up high enough that your legs fit under the chair. The idea is you're looking down on the patient's mouth and you're not out here either bending forward or having to strain your neck. And then while you're sitting, be sure you've got your back straight, supported by your stomach, and not slumping. So bottom line is her legs are like this, and my legs are about parallel to her legs under the chair. Is that a comfortable position for you? Say we're working on the lower right. Then I'm going to retract the lip and the cheek, and my assistant's going to retract the tongue. Then if we're working on the left side, the assistant's going to retract the cheek and the lip, and I'm going to place my mirror as a barrier between the tongue and the tooth so the tongue doesn't get into the operating field. I mean, if you're using a mirror working on the upper left, then the assistant is going to retract the lip and the cheek, and I'll be looking in my mirror, and I'm trying to keep my back as straight as I can. We'll use these small single retractors to retract like this, and your assistant's going to have to hold this, so she really needs to be close to the chair so she's not bent over. And then I can look in my mirror, and you've got a good view right there, good view of the surface of the teeth. Hold the aspirator, and if I'm right-handed, she's going to hold this in her left hand. That puts the least amount of strain on her neck, shoulders, and arm. If you try to hold it in your right hand, number one, you pinch this lip all the time because it's always bumping that lip, and number two, this is really going to put a lot of pressure on your neck and your shoulder, and over time you'll pay a price for that. And that also frees up your right hand to reach over here and get instruments. The assistant's chair should be higher than the dentist's chair. From a view standpoint and a comfort standpoint, you want to be 3 to 6 inches higher than my chair. So that's the Dental Minute. These techniques work, and they work every time.